Thank you, 小童 and 少童 for your graceful performance.
感谢小童与少童为大家带来的舞蹈。
Our next speaker is Adjunct Associate Prof. Sathish Kumar, who is a consultant at SGH. He's going to give us a talk on myeloma bone disease and treatment.
下面让我们把目光转向今天的第3位演讲者，来自新加坡中央医院的顾问医生 Sathish Kumar 客座副教授。他今天将给我们带来有关骨髓瘤骨疾病及相关治疗的演讲。
I must say that the talk by Mr. Mukherjee was really inspiring. Not only that, he's a very natural speaker, and everyone should. I had no problem understanding the pace was good, and the message was conveyed. But I just have to say, talk on 2 points that he mentioned. The first thing is the doctors often have a way of sort of making our lives, day-to-day lives, easier. We see, especially oncologists, we see a lot of unpleasant sights in front of us, and we often make fun of these things in a very professional way. That's a professional way of sort of moving on with our daily activities. So don't be offended if we use the wrong things in the wrong terms. For example, when I was a medical student back in the UK, bypass surgery used to be called cabbage, CABG. So we would call people, he's a cabbage, and patients would feel extremely offended when they say, I'm a cabbage. Actually, it's just a way of saying that you got a coronary artery bypass graft, and that's it really. So don't take offense at the way we talk about day-to-day activities. The second thing is the point of having something to look forward to in life. In sort of coming up with maybe having holidays or spending time with the grandchildren, or taking your bike on a wild ride. I think that's very important, and I think even for somebody like me, I have an objective in front of me that I'd like to see in 3 or 4 years' time, and this is what keeps me going. And one of them would be to improve, see improvements in outcomes of myeloma patients. So, without too much of delay, I'll go to my talk, which is basically on myeloma and bone disease. So what you see up there are the cancer cells in bone marrow, and these are called plasma cells. They normally do a good job of fighting infections when you are ill or otherwise, but when they decide to become autonomous, which is without any having self-control, they increase in number and they start causing problems. So what you see here is an X-ray of a patient with myeloma, and this appearance is called pepper pot skull. Basically, it just means that it looks like a pepper pot with lots of holes in it, and you see the little holes on the skull. These are basically areas that are eaten by myeloma. So, but this necessarily doesn't cause any problem to the patient. Hardly ever, and they are likely to persist for the rest of their life because they don't generally improve and resolve. But although it's alarming, it's not really clinically really that significant. So, this is something that we are all taught as medical students to appreciate. But when you come around and 10 years later realize that it's just an X-ray finding, it doesn't really have much more importance than that in the skull. So coming to today's talk, we'll talk about a little bit of history of myeloma bone disease that I can get from internet, from textbooks. We talk about biology of the disease, some of the treatment recommendations, and some of the recommendations in early forms of myeloma where we don't have a clear understanding of what we should do, and some new studies which are ongoing, and finally to summarize on where we are currently standing. So the first documented case, at least in textbooks that we can see, is way back from 1844, and it's from St. Thomas Hospital in London, I must say this, the patient from the history is a lady called Sarah Newberry, and she was 39 years old, and it's actually a very young age to get myeloma. And but it seems that the story is quite credible in the textbook, and one has to believe what they say. So during those times, sort of the treatment you get is my dream dinner, mutton chop and pork, a glass of port every day, every night. That would be nice. And some orange peel and some wine and arrowroot, and nothing that I will mind. So this is what the treatment they got, and the picture depicted fairly gruesome, and it's you can see that the whole body is contorted, and the bones are all dislocated, and she's got severely damaged spine, and all the whole body is basically damaged with myeloma. And on autopsy, it was noted that she had spongy, bones were spongy, and they were replaced by red tissue, which I believe is probably massive myeloma cells sitting and eating away the bone. So this